I am currently doing my adult placement at Long Island Care Center in Flushing. It is a subacute rehab facility. My case study presentation will be on Mrs. P. So, to have a little bit of a background, Mrs. P has an admitted diagnosis of a cerebral infarction. So, the definition of that is a cerebral infarction is an area of necrotic tissue in the brain resulting from a blockage or narrowing in the arteries supplying blood and oxygen to the brain. Symptoms of cerebral infarction are determined by the parts of the brain affected. Infarctions will result in weaknesses and loss of sensation on the opposite side of the body. If the infarction occurs on the left side of the brain, speech can be slurred and reflexes may be aggravated as well. A little bit of background information on Mrs. P. She is an 86-year-old female from Cuban descent. She only speaks and understands Spanish. She was admitted to Long Island Care Center on March 29, 2018 from Mount Sinai Hospital in Manhattan. She currently resides with her daughter in Sunnyside, Queens. Mrs. P was admitted on a chopped with thin liquids diet. The SLP at Long Island Care Center found that this diet consistency was appropriate for the time being. We asked Mrs. P and her family if she would like an upgrade. She stated that she would be fine with a chop consistency for now, and that she understands that this is her safest consistency for the time being. So her admitting diagnoses are here. She has major depressive disorder, which is recurrent and moderate, cerebral infarction due to embolism of left posterior cerebral artery, hemiplegia following cerebral infarction affecting the right dominant side, so she has right-sided weakness, chronic obstructive pulmonary disease, and type 2 diabetes with unspecified complications. So originally we did a speech screener on Mrs. P and she passed. She did really, really good. But later on, about 2 days after the speech screener, which stated that she was not a candidate for speech therapy, the family met with the SLP and they stated that they found that Mrs. P was slurring her words and became fatigued while speaking. They also said that she has signs of anomia during conversation. So although she passed the speech screener, the family wanted some speech therapy to further improve her speech and language skills. So the speech pathologist agreed to see her and provide some maintenance therapy. So the speech evaluation was completed on April 5th. The resident was cooperative throughout the evaluation. The family was present, and the speech intern served as a translator. The resident's mother and daughter and granddaughter were present. The resident's primary language is Spanish. She only speaks Spanish, does not understand English at all. And the resident demonstrates signs and symptoms of anomia during conversational speech. The resident was able to recite automatic speech to 75% accuracy. She was able to answer yes and no questions to 95% accuracy. After being read a short paragraph, the resident was able to answer WH questions to 50% accuracy. She was also able to name 1 out of 5 items in a category. So the treatment diagnosis is aphasia following cerebral infarction, and the procedures that were done were speech and hearing therapy and evaluation of speech production. The speech goals, so the prognosis is favorable secondary to having a recent cerebral infarction. Speech therapy was done 3 times a week for 30 minutes for 4 weeks. The speech intern will be providing therapy for Mrs. P simply because her primary language is Spanish and the speech intern speaks Spanish, speech intern being me. And this is the only way to do therapy because she doesn't understand any English at all. Her long-term goal is that the resident will develop functional cognitive linguistic based skills to communicate wants and needs effectively to different conversational partners, maintain safety, and participate socially in a functional living environment. Her short term goals are that the resident will produce higher functioning automatic speech to 95% accuracy. The resident will list 3 out of 6 items in a category to improve word finding skills. So, the types of categories that we have are sports, we have breakfast foods or drinks, we have states, we have fruits. Originally, for the screener, for the evaluation, she was only able to name maybe 1 to 3 items in a category, and this was after very long pauses to help her, like to give her time to think. The third short-term goal is that the resident will improve auditory comprehension to 85% accuracy with WH questions following simple paragraphs read aloud. And the resident will imitate oral motor exercises to increase lingual strength and range of motion 10 out of 10 times following direct models. The goals for Mrs. P are appropriate and address the issues she experienced secondary to her diagnosis. Her family reported that after prolonged conversational speech, Mrs. P would begin to slur her words and exhibit word finding difficulties, and Mrs. P overall word finding abilities and auditory comprehension skills have improved over the course of therapy. So what we do in therapy is that the session begins with casual conversation about her day and her weekend, and then we go into oral motor exercises since she has right-sided weaknesses because of the cerebral infarction. So her right side is affected. So we begin with the oral motor exercises. Then I ask her to list 5 to 6 items in 4 different categories, such as sports, fruits, breakfast foods, and states. Originally, we only did about 3 in each category. Now we do 5 to 6, and she's able to do it automatically. She doesn't take as much time to think about it. She doesn't take as many pauses. Session would be concluded with auditory comprehension tasks. So I would read 2 to 3 short passages in Spanish and then ask Mrs. P a series of questions based off of what I just read. There are times where I need to reread the paragraphs twice, or I cut the paragraph into 2 pieces. So I'll read 2 to 3 sentences first and then ask her a couple of questions based off of the sentences I just read, and then I'll continue with the rest of the passage. So for the first half of therapy, she does really, really well, and she has shown great improvement, and she showed improvement in the passages as well, but they seem to be a little difficult for her. She has to really, really try to focus on the information that is being read in the passage. And once again, the entirety of the session was done in Spanish. She says that she likes to have speech therapy simply because she's able to have a conversation with someone in Spanish, because the majority of the people in the facility do not speak Spanish. So unless her family's there, no one really talks to her. So she has a really good time in speech therapy. So the practicality of the goals, according to Constantius, Rieger, and Mummery and Hodgetts in 2017, therapy should follow a hierarchy where targets are set just above current levels of achievement. Studies provide evidence that there are distinct neural substrates for accessing the representation of objects and actions. More specifically, a number of chronic lesion deficits. Correlation studies have indicated that impaired naming of actions result from frontal lesions associated with non-fluent aphasia and or medial occipital regions, whereas impaired naming of objects results from posterior temporal lesions associated with fluent aphasia or anterior inferior temporal regions. Also, classically, auditory comprehension deficits in aphasia were thought to result from impairments in perceiving speech sounds. However, a number of studies have now shown convincingly that word-level comprehension failure in aphasia are attributable at least as much as the post-phonemic breakdowns than they are to deficits at the phonemic level. So Mrs. P will be discharged, anticipated following successful completion of the rehab program. So she's here short term, just until she gets better. for OT, PT, and for speech therapy. And here are my references.